Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. The theme of my today's podcast is about the measles epidemic among our children, United States, and Mexico. So I'm basically going to talk about how you understand the anatomy of the measles virus, what are the symptoms, what are the complications, and finally prevention, the public health response, and the massive immunization at the corners. And before I start my views, my views are mostly educational, and I really advise our listeners, whether they are traveling or whether they are home with a sick child, always consult with their primary care physicians, with their infectious disease and the travel medicine protocols as advised by the travel medicine infectious disease people. So first of all, I am going to talk about this now. The first slide, please. Now, as we know, measles, it is one of the most contagious viral disease. And how is it spread? It is spread by contact with the infected nasal secretions, cough, and sneezing from an infected individual. So, very interesting fact to know, if you are working in a doctor's office, if you are a physician or a patient there, these viruses, they remain active in a contaminated environment for 2 to 3 hours, no more than 4 hours, because then they die. So the best thing, this is the period when somebody spreads the infection. So best thing is taking the precautions, which I'm going to talk to you about. So what do we know about the measles virus? Second slide. What is the history about measles virus? This virus was first described in 17th century by a Persian physician, Rhazes, in the 10th century, and it was described as the more toxic virus, even than smallpox. Now, the first licensed attenuated vaccine, which is called the Edmundston B strain, was licensed in United States in 1971. And this vaccine has its name because of Edmundston, who invented this first virus. And this is the measles, mumps, and the rubella vaccine. For a while, the measles was no more. They were completely eradicated, except for the non-immunized individual in third world country. Unfortunately, right now, there is a big surge of measles it started with Mexico around the borders, and now it reached the United States. So, what is the structure of a measles virus? Next slide, please. Okay, so this is the measles. It belongs to one of the group of paramyxovirus, which is an RNA virus. And what is RNA? I don't want to go into details for the listeners about the anatomy in detail of this paramyxovirus, but I have included them in my bibliography. So this virus belongs to the Paramyxoviridae family. Means it is a single-stranded RNA virus, and the structure includes, like you can see, the outer area, the ribonucleocapsid. It is an envelope, and then it has two key viral protein, the heme agglutinin, and the fusion which is called the glycoprotein. And again, the biblio has got the detail about the structure of the virus. So now, the third slide, please. The measles virus, how is it transmitted? It spreads through contact with the spread airborne or droplets such as coughing, sneezing. Infectious window is really very interesting to know for us that the infection period is even before the symptoms and the rash develop. The infection the window is four days before and 4 days after the rash. And the survival virus, it remains active in the air structure for a long time. So, in other words, this virus is contagious in 90% of the non-immune contacts who get infected. So this is one of the example of RNA virus disease. Besides measles, the other viruses are orthomyxovirus, hepatitis B, the Ebola, SARS, influenza, and the retrovirus, that is human T-cell lymphotropic virus. Don't want to go into the detail, but just so that we know that the current vaccines, which I will talk at the end, has a combination of measles virus, the RSV virus, and some variant of the COVID virus, which are still there. So now what about the symptoms in children and adolescents? The early symptoms that a child will present with, or even adolescent or adults, is fever, cough, running nose, watery eyes. And after 3 to 4 days, the rash appears. It is very important to know that before even the rash appears, if we examine the mouth and the mouth of the patient, they will have like coplic spots, like a whitish spot in the mouth, and that appears even before the rash. So just to remember the 3C of measles: cough, coryza, and conjunctivitis. They will present with the conjunctivitis. So the next slide here is the complications of the measles. If it is not treated properly, the most important thing for the children, mostly they come to the emergency room with the earaches, that is an ear infection, otitis media. Once the virus goes to the lungs, they develop bronchitis, pneumonia. They are dehydrated because of the lack of oral intake. And in severe cases, which is rare but is still going around, severe encephalitis, which is called a subacute sclerosing panencephalitis. And all these symptoms are very high. They are the high-risk individuals are those who are not vaccinated. So now, what do we do about the differential diagnosis? So the treatment of the measles, basically the three major organs affected by the bloodstream are spleen, lungs, and the brain. So now what are the treatment regime and the supportive care? A major supportive care is very important because there is no specific treatment, no specific antiviral treatment. So far, it hasn't come out with any. So the conservative treatment, supportive treatments when patient are sick includes lot of fluid, reduce the fever, control the fever, maintain the hydration generally because they get dehydrated from vomiting, nausea, and others. And the vitamin A supplemental, which I will go through later on, which is very important. So, what are the sanitary precautions? This virus is readily killed by household disinfectant, a good thorough hand washing. Hand washing is still the best. And a dietary restriction. There has been a lot of written articles about the dietary restrictions, and I have included that in my bibliography. Try to avoid greasy, fried food and eat foods rich in vitamin A, such as the spinach and green vegetables. So now the public health concern, very important because we have travelers who are going to go to the other country. They have other people, the other travelers who are coming into the country, and they bring the virus with them. And like I mentioned before, these are the individuals who are not vaccinated. They don't have a complete immunizations and the vaccines. So the travel medicine precautions are very, very important. Travel medicine, there is a pandemic of measles in Mexico, United States. And like I said, these ones started with the unvaccinated individuals coming from the third world countries, and then unfortunately Texas was first initially became the victim, since they have reported cases of measles in early 2025 due to lack of vaccinations and also due to the international travels. These are the individuals who are coming to the country and they are not adequately immunized. So what precautions are the Mexico and the United States are taking about it? In Mexico, there are several regions at the northern border and the rural areas who have more rising cases of measles. So both United States and Mexico, they are coordinating with the health agency to track the virus outbreak across the border. The CDC and World Health Organizations are advising the travelers to be updated with this vaccine, which is so important, measles, mumps, and the rubella vaccine. What are our roles in preventing this pandemic? Our role is as make sure the families are properly vaccinated, stay alert to the health advisories which they can easily check from the internet, and support the public education campaign to fight against this deadly virus. The public schools and the hospitals in those pandemic area, they are having special immunization clinics for the unvaccinated individual. Children under 5 years of age who cross the border, So, what are the proper immunization? The first dose, the CDC recommends the first two doses of MMR, measles, mumps, rubella vaccine. First dose the when the baby is 12 to 15 months, and then another one is about 5 years when they are ready to go to school before entering kindergarten. For the adults, two doses of MMR vaccine are sufficient to give a lifelong immunity. Now, this is a very interesting fact that I'm sharing with you for elderly people and for the grandparents. For the grandparents, people taking care of the elderly individuals in the group homes, people who are born before 1957 are generally considered immune to the measles. They may not need MMR booster. However, the caregivers, the family members who are not sure about the vaccination should seek help from their infectious disease physician or their own doctor and the travel medicine regarding their adequate immunizations. So, what are the recent trends in immunization against modified vaccines? The vaccine currently that is we are all advised to take is a combination of RS virus, the measles vaccine. The public health system should be prepared to take advantage of the scientific breakthrough in vaccine technology. The THE new vaccines should have potential to include the health treats, including treatment for the cancers, chronic disease, antimicrobial resistant pathogens. And these vaccines are coming up. I reviewed so many literature studies, and we are going to have very soon in future the vaccines that will fight against the cancer, the fit against the cancer, several cancer. That has been a documented fact that has been reported in the journals. The MMR vaccine basically is the control of measles, like I said before, is a live attenuated vaccine. And what does it do? It stimulates the immune system in our body. And then later on, once they are vaccinated, they are safe to travel. However, when they go to any other countries, safe going to the other countries, before they enter, they should be checking for the symptoms. Anytime if they have a symptoms of rash on the body, or they have cough, cold, bronchitis-like symptom, they should be checked before they enter the particular country. Now, I have provided our reader with a surge of measles viral global and a complete immunization guidelines towards the immunization. These are my own views from my personal experience as working in the clinics, emergency room, urgent care, and dealing with the individuals with infectious disease. But however, I do advise all my viewers to get a complete consultation with their physicians, pediatrician, infectious disease expertise, and the people going to this. I don't have in my slide, but I have it in my photo camera that I want to share rash. I have it for the rash. Now, as we know, The measles usually start from face. It goes from the face, goes to the neck, and this is like a maculopapular rash which spreads in the upper part of the body. So if you see a baby in the emergency room who has a rash, this rash could be roseola or anything else, but I'm going to show it here. So basically, this is a baby with a maculopapular rash over the face and then in the trunk. This virus descends from face, neck, and there. There are more interesting. There are more interesting viruses pictures about the measles, which I could not include it, but it is included in my bibliography, photo camera with all the viruses about, especially more about the measles virus, how it spreads. So, in summary, like I said, this is a brief review about the measles vaccine, and like I said, in summary, measles it is a preventable, but it is a dangerous disease. Yeah, vaccination is the keynotes. Vaccination is the key factor, and vaccinations is very important in our population general to control this outbreak. Coordinated public health efforts are the key factors, because the public health, they report which states in United States show more measles, where it is declining. So always keep yourself tuned with the public health public health department, and stay informed about stay with the current information. Every day I see at the CNN and I see at YouTube about the new measles outbreak. How many people are there, and then how many people so far. There has been 3 mortality due to the measles, which is a very sad incident. So like I said before, I went through the structure of the virus, I went through the clinical features, the complications of measles in our community, and the proper immunization schedule. And I have included in my bibliography about the CDC protocol, about the current immunization schedules, and I like our viewers to when they share my informations on my Health Talk podcast, to get in touch with the CDC protocol, the American Academy of Pediatrics guidelines, the Human Health Services, about the proper immunization and prevention of this viral disease, measles. I'd like to thank our viewers for watching me today on Health Talk. And the topic was emerging viral disease, measles, which have have a pandemic in Mexico and United States, and the prevention and emphasizing on the vaccines. I'd like to thank our producer, our camera people for helping me produce this show. Thank you again.